talking about osteoporosis. So this is basically weakened bones to the point that they can break very easily. It is basically called the silent disease because people who develop it may not notice any changes until a bone breaks. And usually the bone that breaks is basically the bone in the hip, the spine, or the wrist. In very severe cases of osteoporosis, a simple motion such as a cough or even a minor bump into a furniture can result in a broken bone, what we call a fracture. And people with osteoporosis also have a harder time recovering from broken bones, which sometimes causes pain that does not go away. Broken hip and spine bones are especially serious, as these injuries can cause older adults to lose their mobility and even their independence. So who gets it? Well, osteoporosis can develop in any race or ethnic group, but some groups are more likely to get it, especially women over the age of 50 years old. And some other risk factors include having a family history, having a history of broken bones after age 50, if you have had previous surgery to remove your ovary before your menstruation period stops, before menopause, if you have poor dietary habits including not enough calcium, vitamin D, or protein in your diet, if you are physically inactive and you're on a prolonged period of bed rest, if you smoke cigarettes, you use alcohol, or if you have long-term use of certain medications such as corticosteroids, proton pump inhibitors for the stomach, and even anti-seizure medication. If you also have altered levels of hormones, such as if you have thyroid problem, or if you have too little testosterone if you're a male. If you also is underweight, you're more likely to get osteoporosis. So how do we treat it? Well, treating osteoporosis means you're trying to slow down or stop the bone loss to prevent it from being broken. So how do we treat osteoporosis? Well, your doctor can recommend lifestyle changes and medication to lower your chances of breaking a bone. These include eating foods that support bone health. So you need to get enough calcium, vitamin D, and protein each day. So low-fat dairy, leafy green vegetables, fish, and fortified juices, milks, and grain are a very good source of calcium. And if your vitamin D is low, you can talk to your doctor about putting you on a supplement. You can get active by doing weight-bearing exercises like strength training, walking, hiking, jogging, climbing stairs, tennis, and even dancing. You can also stop smoking as well as limit your alcohol consumption. Your doctor can also prescribe you some medication that slows down bone loss as well as medication that rebuilds the bone. And that's it on osteoporosis. If you have any questions, drop it in the comment section below. And what's your experience with osteoporosis? Drop that as well. And don't forget to like, comment, share, and subscribe for lots more interesting content. Until next time, see you soon. Bye.